BII, also known as breast implant illness, is a new approach in the United States that actually has been going on for a while in Europe with our European colleagues. What's really special about this concept is, I think for once in the US, most of us plastic surgeons and physicians are realizing there may be some systemic concerns when a female has had an augmentation. In the US, the most common plastic surgery procedure still is breast augmentation. And depending on the statistics per year, there's anywhere from 300 to 400 to 420,000 women undergoing breast augmentation. Thus, it's a very, very common procedure amongst plastic surgeons and in plastic surgery. However, we do see a population base, about 25% of women who've undergone breast augmentation, with recurring symptoms and problems, and this is dated in the literature. Traditionally, we used to kind of, I think, especially when I was in training, used to tell the patient, and that has no correlation. Your implants have no correlation to your immune system. Your silicone that's ruptured has no correlation to your fatigue or your chronic illness. I totally disagree with that, because it is a form of stressing the immune system when you have a ruptured implant or a chronic capsule. Why is that? Because the body's developing this capsule for some form of protection because something's going on. Most women, especially with the older generation of implants, such as the old generation of silicone implants, that was a silicone shell with liquid silicone. And sometimes what would happen, the shell would fracture or tear as the decades or years progress, and the liquid would seep into the breast pocket. And you could imagine the inflammatory response that the body has to prevent that silicone from seeping throughout the breast pocket. And so what develops is a strong capsule, meaning scar tissue. It's a normal protective response of the body to conceal the seepage or the spillage of the silicone implant. The capsule has multiple grades. Grade 1, 2, 3, and 4 is the most extensive. When you reach the grade 3 and 4 capsule, it's cocooning the seepage of the implant that's been ruptured, torn, or damaged. And what it's doing is that's a normal response of the body to process an inflammatory response, but also to process scar tissue that is going to prevent it from seeping in, let's just say, to the systemic system, the lymph nodes, etc. When the capsule develops, it's a very hard tissue, and sometimes if it's really, really chronic, calcification can develop around the capsule. So the objective here with the whole concept of en bloc resection is to meticulously, and the word is meticulously, dissect the surrounding fatty tissue or the muscle off the shell and remove the entire capsule with the cocooned or contained ruptured silicone or even ruptured saline implant as one whole unit. And why is that important? Well, you know, there's a discussion amongst our community that some of that foreign object that remains, some of that capsule that remains, can again ignite a niche, an inflammatory process. Even if we were to just say, if the patient was adamant about getting a new generation of implants inserted in, you leave that little niche behind, it could start this whole new process, again, of a new foreign object coming in and starting that capsule formation, that rejection of that new implant. So how does this process work? And the concept that I like to approach is preoperative optimization, number one. Not walking in blindly into the operating room and just removing these chronic implants or chronic capsules or ruptured implants. Preoperative optimization to build your immune system. Come into the operating system with the most optimal foundation present. Working with an experienced surgeon and an experienced staff, removing hopefully the entire unit as what we call, as our French colleagues call, en bloc, as one unit, meaning the implant cocooned within the capsule and hopefully no seepage, spillage, or remnant being left behind. Once that's removed, re-exploring the pocket immediately while the patient's asleep, removing any further capsule or any concerning tissue that's there, and then for a possible quicker recovery for the patients to consider, it's not mandatory, but to consider some stromal vascular fraction. Why is that? stromal vascular fraction is what we call sometimes concept of stem cells. And that can help develop and boost the autoimmune concept that they're walking in with. And also it helps speed up the recovery of the process. And post-surgery, to work with a team that's really qualified in handling your post-care. So when you efficiently optimize all three categories, pre-op, surgery, post-op, then that's where the success results come into place. And that's where we see success stories by patients. They start feeling better, they feel more confident, but more so they feel more energy. And I've seen patients immediately, sometimes within 72 hours, feel like a completely different human being. You know, this is not necessarily a new horizon in medicine, but now it's becoming a topic of discussion when patients are coming in with chronic illnesses or autoimmune diseases, how to further optimize their immune system and what is really depleting their reserve of their immune system. And this may be the source at this point. So I think it's very important that any patient who has a chronic illness, an autoimmune disease, something debilitating, even chronic fatigue, to really have their implants evaluated.